You're about to discover secrets to help your patients see the need for care even in the absence of symptoms and accept and pay for best option, complete dentistry. I'm going to share 7 gems and we're starting right now.
And now, Amazon #1 best-selling author, Dr. Tom, the Gems Guy, Orent.
Greetings from Planet Gems. I'm Dr. Tom Orent, aka the Gems Guy. 20 years ago, I was $1 million in debt, divorced, embezzled. I came within 3 days of bankruptcy. Good dentist, but I was clueless when it came to the business part. Almost lost my practice and my home. Then I stumbled upon a gem and then another gem, and they actually began to help. So I began actively searching for gems, strategies to help me rebuild my practice and my life. At age 46, I was able to retire. Since then, my passion has been helping dentists help your patients say yes to your best care, helping you have more fun and make a whole lot more money. If you're a general dentist and you could use a $200,000 bump in Crown and Bridge this year and every year moving forward, then you're in the right place. Gem number 6, 95% of your patients can afford best option dentistry. This is the story of a 78-year-old housekeeper working the graveyard shift at LAX International Airport in Los Angeles. She helped me to see the truth, the real reason that our patients tell us they can't afford the recommended care. As general dentists, the majority of the care that you recommend, well, it's to solve problems about which your patients are clueless. The Holy Grail? Help your patients accept best option long-term dentistry, even when you're recommending it in the absence of any symptoms. Okay, here's the story. I'm at LAX. It was nearly midnight. I'm sitting at the gate waiting for a red-eye from LA to Boston. Half asleep, out of the corner of one eye, I'm watching this 90-pound, 5-foot-tall elderly woman pushing one of those big, huge, heavy carts with all the mops and brooms and the cleaning supplies. I felt badly for her, knowing that she wasn't doing it because she wanted to, she had to. Then her cell phone rang. Now she's pushing the cart with one hand and she's chatting with cousin Mabel holding the phone with the other hand. So what does that have to do with your patients? Everything. The average family in the United States and Canada spends over $450 a month on their 3 cell phones, cable or satellite TV, Netflix, iTunes, apps, games, and downloads. Frankly, I think they're probably spending even more than $450 a month. Now let's look at how much it costs per month to finance one quadrant of best option long-term excellent dentistry. Crowns, build-ups, implants, 3 or 4 teeth in one quadrant goes for about, let's say, $4,000 or $5,000. Well, to finance $4,000 or $5,000 for 60 months through CareCredit or any third-party financing company, you're looking at about $70 or $80 a month. At the same time, your patients are telling you that they can't afford your care, they're spending $450 a month for the cell phones, TVs, and other non-essentials. Will you be able to convince them to give up those things in order to choose dental care instead? No, of course not. That's not the point. But in order for you to dramatically increase case acceptance, you first need to understand why most of your patients say they can't afford it. In the absence of symptoms and based on the traditional ways in which you're recommending care, many patients simply don't believe that they need the care, or if they do kind of believe they need the care, they just don't see any reason to believe that they need it right now. And it's much easier to tell you that, well, it's just not a great time financially than to tell you that they don't believe your recommendation. Write this down. To improve case acceptance, you must create a sense of immediate and urgent need. Gem number 5, 3 simple treatment planning rules for your new patient exam. I'll preface this by saying that I loved Pete Dawson, took the entire continuum, didactic and the over-the-shoulder. I learned a ton from Pete and I became a much better dentist as a result. I was accredited by the American Academy of Cosmetic Dentistry and subsequently I served for 6 years as an AACD accreditation examiner. Now, I'm not telling you these things to brag. On the contrary, it's important that you know where I'm coming from when you hear my 3 rules for treatment planning, the asymptomatic, hey doc, I think I'm just fine, all I need is a cleaning and a checkup, new patient. Because during the first couple years following the Dawson Continuum, I performed at least a 90-minute new patient exam on just about every adult who came into the practice, including the usual stuff plus 3 Delar bites, mounting and centric. CentriCheck on the articulator to confirm that we actually did mount and centric, TM joint ultrasound on pretty much everybody, and more. That followed by saying, we'll need to have you back to discuss your case next week after I've had a chance to review our findings. And by the way, please bring your husband. One day, Isabel, my office manager, sits me down and she says, Dr. Orent, since you took all these courses, you've become a much better dentist. but you've chased away just about every one of our new patients. Sadly, she was right. Some brand new patients accepted my Mondo treatment recommendations right off the bat, but most of them thought I was nuts, ran out the back door and never came back. Once I developed my 3 simple rules for the new asymptomatic patient, my new patient exams only took a fraction of the time. The majority loved us and they stayed with the practice. Rule number 1, don't hurt them. But Tom, does that mean it's okay to hurt your long-term patients? Of course not. But if Mrs. Jones has been with you for 8 years and you give her a slightly painful injection, you've built up enough trust and relationship. She's not going to leave you over one ouch, but on the other hand, hurt your new patient during the first injection and that may be very well your last. Rule number 2, don't take much of their time. Your new patient wants to be out of that initial examination within less than an hour after arrival. Your treatment plan should be no more than 2 or 3 short visits. Rule number 3, don't take much of their money. Your new asymptomatic patient treatment plan should cost them out of pocket well under $1,000. But Tom, is it ethical to withhold telling them what you see if you know that they need more extensive, expensive care? No, it's not. And there's the dilemma. Tell them everything you know that they need right away and they may never return. You got to figure out an ethical way to tell them only a few quick, easy things, some inexpensive things for now. You have an excellent chance that they're going to not only be back, but they'll accept your recommendations for best option long-term complete dentistry down the road as a result. More on relationship and case acceptance in just a moment. If you're finding this helpful, I'd really appreciate it if you could click like and share this with other dentists. If you're a general dentist, join our complimentary community of dentists around the world sharing gems to improve patient care, have more fun, and make more money. We'd welcome you to join our free Facebook group, Dental Goldmine Mastermind. There's a link in the description below. Gem number 4, how your best technology can be your worst enemy. First, a story. This goes all the way back to the days when most of us had VCRs, that's video cassette recorders for you young tykes. One of my top-selling videotapes was about how to use an intraoral camera for the new patient exam. Even the early versions of intraoral cameras were really good at getting patients to say, "Yuck, that's my tooth, doc, what can be done about that?" In fact, today's high-resolution DSLR photography is one of the best ways to get patients emotionally involved with and taking ownership of their problems, especially in the absence of symptoms. If you want the chance to treat the whole patient to complete dentistry and not just one tooth, in the absence of symptoms, your brand new patients need time to build relationship and trust. Would I recommend the use of high-resolution intraoral photography? Absolutely. But the timing of when you introduce photography is going to have a critical effect on your new patient relationship and consequently on the likelihood she's going to accept and move forward with your recommendations for best option complete long-term dentistry. Don't forget to subscribe so you won't miss a thing and hit the bell notification so YouTube will let you know when I release my next video. Would you like to protect your adult patients against cervical caries by getting 80% acceptance of adult fluoride paid willingly out of pocket? With just 7 simple sentences, you'll add $40,000 per year per hygienist. That's $200,000 of pure profit over the next 5 years. How might that change your lifestyle? Done for you in just 30 minutes. Enjoy free one-on-one 7 simple sentences fluoride verbal skills training for doctor and team. Get your free live training at gemscripts.com/2. There's a link in the description below. Gem number 3, the bobble-headed dog. You've seen them. You pull up to a stoplight. The car in front of you on the back shelf has one of those little bobble-headed dogs and the dog's head's going up and down. Well, here's my theory of the bobble-headed dog. When the doctor is the first to tell an asymptomatic patient about the need for care, again in the absence of symptoms, the patient's response is often something to the effect of, "Doctor, are you trying to send your kid to college on my mouth?" Or sometimes they'll say, "Are you trying to make the next payment on your Mercedes?" And even if they don't say anything, many patients are thinking about this. As a result, in the absence of symptoms, patients are going to trust your hygienist way more than they're going to trust us, the doctors. When I realized this, I trained my 5 hygienists to tell patients about their problems and what the doctor might recommend before I or my associates ever walk into the room. By the time the doctor enters the room, we're just a second opinion, bobbing our head up and down, agreeing with what the hygienist found and what she recommended. Adopt the gem of the bobble-headed dog and watch your case acceptance shoot through the roof. Do you have a gem that you use to increase case acceptance? If so, let us know about it in the comments below. If this has been helpful so far, you'll love the in-depth team trainings. Bobble-headed dog achieves maximum case acceptance. New patient retention, the 2020 exam, and how to sell best option quadrant dentistry. If you're a GEMS Platinum, ask your personal concierge for access, but even if you're not, I'm happy to share these with you for free. Take a 6-week free test drive of GEMS Platinum. During your first 6 weeks, deploy even one gem, you could increase by $40,000 in annual revenue. Gems are fun, they won't take much of your time, and they're really easy. You'll pay just $6 one-time shipping. Gems are so easy, I'm offering you a 10 times money-back satisfaction guarantee. All I ask is that you speak with your GEMS concierge. Together, you guys choose just one easy gem to deploy during your 6 weeks free. If for any reason you're not satisfied with gems during your 6-week free test drive, just let me know and I'll refund $60. That's 10 times your $6 shipping fee. To get your 6-week free GEMS Platinum, go to gemsyoutube.com. There's a link in the description below. Gem number 2, if you were thinking, well, hygienists are not legally able to diagnose or treatment plan, then you're correct, they're not. And here's my disclaimer, I'm not an attorney, you may want to ask yours, but here's the word-for-word verbal skill that I trained my 5 hygienists to say right before they would tell a patient what's wrong and what the doctor's likely to say when he comes into the room. Mrs. Jones, I'm not a dentist, so I can't diagnose or treatment plan, but I've been with Dr. Orant for 8 years and I can tell you what he's going to say when he comes in. Pete Dawson wrote the foreword to my first book, and Gordon Christensen wrote the foreword to my 4th book, Transform Your Dental Practice from Coal Mine to Gold Mine. It's available on Amazon for $16.97, but I'm happy to send it to you for free just for being here with me in the dental gold mine, and I'll even cover the shipping. With just 2 of the gems in the book, you could increase your revenue by $50,000 a year. While available, claim your free book at freegemsbook.com. There's a link in the description below. Gem number 1. Now, this one reminds me a little bit of a New York Times crossword puzzle. It's a 7-letter word your hygienist can use to instantly make asymptomatic patients aware of an immediate and urgent need. Write down the word concern. She's pointing to a larger-than-life computer monitor image of the tooth in question when she says, Mrs. Jones, I'm really concerned about your tooth here on the upper right. Of course, that's only the beginning of the conversation, but starting with the word concerned is the very first step. Hey, thanks for joining me here in the Dental Gold Mine, and remember, you're only one gem away.